I am going to talk today about neighborhoods, urban nature, and health. And these are all topics that I feel very passionately about. So it's an honor to be here with you today to talk about them. So we're going to talk first just about broadly why neighborhoods matter for health, and have a little bit of a detour to talk about structural racism and how that relates to neighborhoods and health. Then I'm going to spend the next part of the talk talking about nature as a social determinant and going through a little bit of the evidence linking nature and health. And then finally talk about urban nature as a health equity tool and use 3 examples from my own research to demonstrate that. So whether you live on a tidy tree-lined street or in a neighborhood that is marked by industrial plants and vacant lots, or a neighborhood with abandoned houses, the spaces and places around us where we live impact our health. The question really is, does it have a positive impact? Is it health promoting, or does it have a negative impact? I think many people at this point are familiar with this concept that your zip code has as much to do or more with determining your health as your genetic code. And that's really what this is about. I want to build out this conceptual model for you, linking neighborhoods and health. And this comes from Anna Diaz-Rowe in a 2010 paper that I continually go back to because it just is very foundational to thinking about what allows us to be healthy or not. So here on the right side of the screen is health, which is the ultimate thing that we're all sort of working towards. The immediate drivers of health in this model are stress and behavior. Both of those independently impact health, but then of course impact each other. Because when we are stressed, that influences our behavior, whether that's through substance use, physical activity, what we're eating, our relationships, etc. In this model, then the drivers of stress and behavior is in fact your neighborhood environment. And she breaks up the neighborhood environment into the neighborhood physical environment and the neighborhood social environment. The physical environment being things like natural spaces, which is what we're talking about today, housing quality, other aspects of the built environment. Much of my work is really centered on that physical environment piece. And then the social environment is about social connections, about institutions and norms, and about safety and violence. And of course, those impact each other, as I will show you with some of my work. Now, the real reason why I love this model is because it takes it a step further and asks, well, why do our neighborhoods look the way they do in the first place? And so if we're thinking about neighborhoods and health, we really have to go further and ask that question to get at some of the root causes of poor health. And in this model, the things that drive the way our neighborhoods look and are developed is really segregation by race and socioeconomics and resource inequality. And it's those things that really get at that picture of structural racism. Segregation, and then at the bottom here, of course, are personal characteristics. So your genes, your biology, and then your individual resources play a role in your health. When we think about segregation, segregation is really the defining feature of American neighborhoods. This is a map of Philadelphia, and the different colored dots represent different races. It doesn't even matter what race is represented by what color dot. The point is that you can look at this and see that Philadelphia is a segregated city. Even in the zip code that I live in Philadelphia, which is the 4th most diverse zip code in the city, I can tell you that when you are here in the neighborhood, there is still segregation within the zip code. There is a street that is a dividing line, and most of the Black people in the zip code live on one side of the street, and most of the white people live on the other side. Of course, it's not, a perfect division, but there is even micro segregation within zip codes. And so when we're talking about neighborhoods and talking about place and race are intimately intertwined. And why is that? These 2 articles are fantastic in thinking about some of the history of this. This article in 2014 that came out called The Case for Reparations by Ta-Nehisi Coates in The Atlantic. I highly recommend you read this article. It really goes through sort of the legacies of slavery, of Jim Crow, and how that the policies and procedures over time by our government have led to segregated neighborhoods, and really gets into the concept of redlining, which I'm going to just talk about very briefly. This other article on the right called What is Owed is by Nicole Hannah-Jones, who is one of my favorite authors and writers and thinkers on matters around race. And this came out in June of this year and is really about reparations, but goes really through a very long history of structural racism and how that manifests today. So I highly recommend both of these articles. Getting into redlining a little bit, and this is important to talk about again, because it is one of the things that has determined what our neighborhoods look and feel like. So in the, and I would say today, a lot more people have heard of redlining than when I gave talks, a year ago and talked about redlining. I think the murder of George Floyd, the national protests that followed, have led to, I think, much better education about around issues like this and redlining, which is encouraging that more and more people are hearing about this. So basically, I'm going to just do this in a very broad stroke. The federal government created the Federal Housing Administration. And the Federal Housing Administration basically changed the way that homeownership and the ability to buy a home was operated in this country. They insured private mortgages, they decreased the amount that was needed for a down payment to that standard 20% that is today. It used to be much higher. And they made it standard to be able to repay a loan over 20 to 30 years. The result of this and other things that followed was that homeownership rates increased dramatically in this country. And that really has become a bedrock of how people build wealth in this country. What the federal government did in determining who would be eligible to get those loans or not was deployed teams to go within cities and neighborhoods and determine which neighborhoods were eligible or not. They color coded those eligibilities on a map, and the red areas were ineligible, hence the name redlining. Literally, red lines were drawn on maps. No surprise, the A-rated neighborhoods, the best-rated neighborhoods were neighborhoods that had excellent prospects with no Negroes or foreigners. The D-rated neighborhoods, which were those red line neighborhoods, were typically neighborhoods that had a lot of Black people in them or immigrants. This is, again, a map of Philadelphia showing the actual, from the 1930s, redlined map. And it's not a perfect correlation, but many of the neighborhoods that are the poorest and the Black neighborhoods today sort of map onto the areas on here that are red. Beyond redlining, often what happens is the government does something and then the private sector follows. And so beyond redlining, there were racial covenants where it was actually written into the legal deed of a house that you could not resell your house to a non-white family. There were things called buying on contract and blockbusting, which again, were speculators and other people who were selling houses did things to purposely sort of either drive people out or prevent people from coming in. This is a quote from the National Association of Real Estate Board Code of Ethics, in which it was determined to be unethical or unethical to actually bring, for example, Black family into a neighborhood where there weren't Black families. So again, this is both, the government and then the private sector and determining who gets to live where. As a result, homeownership rates are vastly different in this country based on race. The green line at the bottom is Black homeownership, and the dark blue line at the top is white homeownership. And this is showing over time from the 1980s to 2015. In 1980, there was a 26% difference in between white and Black homeownership. In 2015, that rate had widened to 31%. Largely as a result of the housing crisis, which hit Black families harder than white families. One of the really the outputs of this and one of the detriments is around wealth. And I talk about wealth because wealth is really important for health. It has many implications on health. And there is a huge white-Black wealth gap in this country, as well as a white-Latino wealth gap in this country. You can see, I'm just going to go through here. This again is just showing how that gap has widened over time and how the financial crisis really hit Black families harder. And we're actually seeing that now also the economic implications of COVID are hitting Black and Latino families harder. But you can see here this is median household income. In 2013, the median household income for white households was $116,000. was the median household income for Black families was $1,700. And so tying this all back to neighborhoods and the physical environments of neighborhoods, this is a quote from a book from 1995 called Black Wealth, White Wealth. And it says, locked out of the greatest mass-based opportunity for wealth accumulation in American history, that's referring to homeownership, African Americans who desired and were able to afford homeownership found themselves consigned to central city communities where their investments were affected by the self-fulfilling prophecies of the FHA appraisers. Cut off from sources of new investment, their homes and communities deteriorated and lost value in comparison to those homes and communities FHA appraisers deemed desirable. And that part in bold, again, that's the deterioration of the physical environment in these neighborhoods. There's a lot more that has gone into this and determining the way neighborhoods look and feel today, but this is just sort of broad strokes to really link for you the historical context of structural racism and what we see today. And just so we're all on the same page about what is structural racism, I think when most people think about racism, they think about individual interpersonal racism, where one person of a race does not like another person of a different race and is prejudiced or biased. And that of course happens, but the more important aspect of racism, in my opinion, is really structural racism. That refers to policies, practices, and cultural representations that work in reinforcing ways to perpetuate racial group inequity. And what structural racism does is it allows the privileges associated with whiteness and the disadvantages associated with color to endure and adapt over time. It's not something that a few people choose or don't choose to practice, which is when we think about interpersonal racism, that's like people making a decision to do that or not. Instead, structural racism is a very feature of our everyday existence, of our social, economic, and political systems. And so the problem is if you're not looking for it, it's largely invisible because we, as a country after the civil rights movement, we really shifted to the idea of sort of colorblind policies and practices. So where race was not mentioned at all, whereas in the Jim Crow system, race was a specific part of our laws and legally sanctioned segregation. In the post-civil rights era, that is not the case anymore, but that the colorblind policies and procedures often disproportionately disadvantage Black and other communities of color. All right, so that is, let me just do a time check here. So that is a little bit about neighborhoods, health, and structural racism. So now just talking about nature, which is something I feel very passionately about. I am, I wouldn't really consider myself a nature person. You can see all the plants in my background here, but for many years I could not keep plants alive in my house despite my best efforts. But I felt I had to learn really how to keep plants alive if I was going to be doing work about nature. I've never been someone who loved to go camping or like spend time in forests. But my research really brought me, it was my research and the science around nature and health that brought me to this place of feeling very passionately that we really need to leverage urban nature as a community health tool. So this is a picture of the Schuylkill Center for Environmental Education in Philadelphia. I'm going to show you a few pictures of what I think of when I think about urban nature, and it's very varied. Basically, any outdoor area with vegetation, that's urban nature. So this is the Schuylkill Center for Environmental Education. You'll see a couple pictures of my kids in here. This is a park called Bartram's Garden, which is in West Philadelphia or Southwest Philadelphia, close to Penn. And it is an amazing, small park, but when you're in this area, you don't feel like you're in a city. It's an amazing getaway. This is another example. So a rail park. This is the rail park in Philadelphia. It was really modeled after the High Line in New York. This picture is a couple years old, so the vegetation now is a little bit more developed. But this is another great example of an innovative way to bring nature into the middle of a city. And then you have pocket parks. This is another, this is a picture off of Chestnut Street in Philadelphia. Literally, you've got concrete buildings all around, but you make a little space, put some chairs in there, put some vegetation, and there's people in here all the time. And then street trees. So you have a little baby tree on the right there. This is outside of my house. And then, over time, that tree grows into like a teenage tree. And then over more time, that tree goes into an adult tree, and those trees have big impact on health. So what can nature do for health? What are the links between nature and health? The evidence is pretty overwhelming. So living near or spending time in green space is associated with reduced stress, lower blood pressure, better sleep, which has better sleep is, I think, an underappreciated sort of determinant of health, reduced diabetes, improved mental health, better birth outcomes, reduced ADHD symptoms, improved postoperative recovery, reduced aggression, reduced mortality, and more. So these are just some of the things that are from this review paper from Frumpkin in 2016, which I highly recommend if anyone's interested in getting like a broad strokes overview of the links between nature and health. That's one of the go-to papers. And these are some of the mechanisms that link nature and health. I'm not going to go through these too much in detail, only to say that two of the things that I study and that I care most about are these ones on the bottom, the social connections that are fostered in nature and the decreased stress. There's also, there's a great paper by Ming Kuo in the last few years that talks about the immune response as sort of an underlying biologic mechanism that may be one of the unifying mechanisms that links nature and health. And so thinking of nature as a social determinant, the thing is, as most of you probably know, that nature is not evenly, and when I'm talking about nature, urban nature in cities is not evenly spread out. So clean, accessible, and safe nature locations tend to be patterned by race and income in cities. And when you think about something like tree canopy distribution, so within a city, there was actually a great article at some point this summer that came out with a bunch of maps showing the differential in temperature within the same cities on the same day. You could have up to a 20-degree differential based largely on tree canopy. And that, again, has direct health implications. And so the question is, can we leverage nature as a health equity tool? If we're intentional about where we plant trees, create new parks, and how we maintain park spaces, can that be a health equity tool? And so I would posit that yes, it can be. I'm going to tell you about 3 examples from my own research to sort of make this point, and then we'll have time for questions. So the first example is about vacant lot greening. So in Philadelphia, there are over 40,000 vacant lots and abandoned buildings. This is what a typical vacant lot in Philadelphia looks like. And this is typical of many cities in the Northeast and the Rust Belt. These spaces are filled with trash. We find things like condoms and needles here. We think that people likely hide guns in spaces like this because they're easy to hide and easy to get if you need it. And this is another, so this is a picture of a vacant lot, not, probably during the winter. This is a picture of vacant lot in the summer, where you can see just wild, unwanted vegetation. I did a qualitative study, one of my first studies when I came to Philadelphia, just asking residents how they perceived spaces like this and vacant and abandoned spaces. And people felt that they were very unsafe. A lot of people talked about, you could be walking down the street trying to get home, and if you come upon a space like this, you would be afraid that someone's going to jump out and try to hurt you. And so these spaces are perceived to be unsafe and are unhealthy. Again, Philly has a lot of vacant land. The reason for this is, in addition to the things that I talked about earlier with structural racism, the decline of manufacturing and white flight led to maximum population in Philadelphia in the 1950s of 2 million people. And then in the 2000s, Philly has a population of about 1.5 million people. So you had, almost 500,000 people leaving the city and reduced population. And so a city that was once built and maximized for 2 million people, it has much less people on it. That also contributes to vacant spaces. So the Pennsylvania Horticulture Society is a longtime partner of myself and my colleagues, and they created this very simple, low cost and innovative intervention to deal with the problem of vacant land in Philadelphia. And so you can see here, it involves removing the trash and weeds, doing earthwork, building a very simple wooden post and rail fence around the perimeter. There are openings to the fence, but that fence really denotes that this is a space and a place that's being taken care of, and then planting several trees. So these are a few example before and after examples of the greening intervention. This is another before and after example. And then that original picture that I showed you, this is the after example of a green space. So it's a pretty remarkable change in the physical environment. And so we have conducted over the last almost 10 years now a series of studies looking at the health and safety impact of vacant lot greening. And this really came about when Charlie Brannis, who is my mentor and who really started this work, met someone named Bob Grossman, who at the time was running this land care program at PHS at a meeting. And Bob said, this intervention, we feel anecdotally like this is having a health impact. And so they were able to partner, and then I was able to join in that partnership to really rigorously study the intervention and produce sort of very high level of evidence of the health and safety impact of this intervention. So it was just a really great example of a academic and nonprofit partnership to study an intervention, produce evidence, and then to disseminate that evidence across the country. Here's a picture of Charlie, who again is the pioneer of this work and my mentor, and then Keith Green, who now runs land care and is instrumental in, has been instrumental in partnering with us in our partnership to produce these studies, and also knows every single vacant lot in and around and across the city of Philadelphia. So I'm just going to tell you about the very last study on that sort of line of studies that created and built up this evidence base. So we conducted a randomized controlled trial of vacant lot greening and a trash cleanup intervention. Normally, when you think about randomized controlled trials, you think about randomizing people. So for example, you have a drug, you randomize people to either get the drug or to get placebo, not get the drug, and then you see what happens to the people. In this study, we randomized places. And so that was one of the really innovative things about this, is that we randomized places to get this intervention. And then we studied what happened in the areas around, including the people. I apologize, that's my phone ringing. So we randomized 541 vacant lots to get one of these 3 interventions. We interviewed 445 people living nearby. They did not know we were involved in the greening. Maybe perhaps some people could have figured it out, but it was very separate. They didn't know specifically that that's what we were involved in. And then we looked at crime, perceptions of crime and safety, and perceptions of mental health. And regarding crime, what we found was for any intervention, the greening or the trash pickup, and when we looked at all neighborhoods, we found a 4.5% drop in gun crime, gun assaults. Then we looked at neighborhoods just below the poverty line, so our hardest hit neighborhoods, and we found an even greater drop in gun assaults. So sort of implying that this type of intervention can have the biggest impact in the hardest hit neighborhoods. If you live in a relatively well-off neighborhood and you have one vacant lot amidst everything else that is not vacant and well-maintained, doing this intervention probably won't have as much of an impact. But if you live in a neighborhood with a lot of vacant land and a lot of deterioration, then something like this will have a bigger impact. Then what we did was we did a contamination adjusted evaluation where we kept track of all these vacant lots over the course of the study, taking pictures, and we rated them to see how well maintained they ended up being. So, some lots that were greened may have fallen into disrepair anyway, despite being in the study. Some lots that were in the control arm may have been greened by a neighbor. And so similar to in a drug trial, some people are assigned to take the drug, but they may not end up taking it. So what we found when we did that contamination adjusted evaluation and looking at those hardest hit neighborhoods, we found a 29% drop in gun assaults. People also reported feeling safer, which is good because when you have a drop in crime, if people don't perceive that and they don't feel safer, then perhaps it's not having as big of an impact as you would want. But people did report feeling safer and reported a perception and reduced crime. And then one of the things I love most about this is that people reported spending more time outside to relax and socialize. And this is just around the sites that got the intervention. And that, if you remember that the mechanisms linking nature and health, One of them is about social connections, and I think that really speaks to here. And then regarding mental health, we found that people living near lots that were greened reported feeling less depressed after the greening compared to before and compared to control. And that was even stronger for people living in neighborhoods below the poverty line. We did not find any impact of just the trash cleanup intervention on mental health. And again, so the mental health piece I think is really important. There has been a lot of work showing an association between green space, living near green space, spending time in green space, and mental health. But this is, to the best of my knowledge, really the first study that is showing prospectively that you can change the environment and introduce more green space into environment and actually have an impact on people's mental health. So it's pretty, I think, pretty remarkable. All right, so I'm going to switch gears and talk about another study that that is not published yet, but is being reviewed now. And this study was really led by one of my mentees, Max Jordan Ngumene, who is a fourth-year medical student at Yale and spent a year with myself and a colleague at the Urban Health Lab and the CECPR, which is another research group at Penn in the emergency department. So in this study, we looked at tree canopy and maternal pregnancy outcomes. So there's been actually a lot of work showing associations between nature and tree canopy and birth outcomes for neonates. So thinking about preterm birth and gestational weight at birth. But there haven't really been a lot of studies looking at the maternal outcomes and maternal related outcomes with nature. So we looked at hypertensive disorders of pregnancy, which is a spectrum of diseases ranging from gestational hypertension and preeclampsia and eclampsia. So we looked at gestational hypertension and preeclampsia, which I'm terming hypertensive disorders of pregnancy. And these are leading causes of maternal morbidity and mortality. And as many people know, there is a stark black-white gap between these outcomes for women. And so what we did is we had a cohort of 1,943 pregnant women in Philadelphia. We knew where they lived. We were able to overlay that with tree canopy data in the city. And we built buffers to see how much tree canopy was in the immediate area surrounding where women lived. And then we wanted to see, was there an impact on hypertensive disorders of pregnancy? Our hypothesis was that there would be, because there's actually also a good amount of data linking neighborhood green space and cardiovascular outcomes in a general population, but this hadn't previously been looked at in a pregnancy cohort. So this is an example of what this looked like. If you imagine a woman lived here in this red area, we built these different buffers around their home address and then calculated the percentage of the land area that was taken up by tree canopy. And you can see here, this is an actual map of Philadelphia, although this is not where a participant lived, but you can see that some streets have a lot of trees and other streets have no trees. So there's a wide range in our sample of the amount of trees in the immediate living area.
So just to jump in real quick, we're a couple of minutes over already.
Okay, I have only a few more slides. I will try to get through these quickly.
Okay,
so what we found, thanks. What we found was that living in a neighborhood with less than 10% tree canopy was associated with a twofold increased odds of developing hypertensive disorders of pregnancy compared to women who had the highest amount of tree canopy coverage. We found amongst Black women that this rate increased up to 6-fold higher. So when we just looked at Black women, the Black women in the sample who had the least amount of tree canopy had 6-fold higher odds compared to women in the top tree canopy area of developing hypertensive disorders of pregnancy. So this, of course, is an association. This is not causation, but it is some evidence linking the neighborhood environment, and in particular nature, in the neighborhood environment with actual pregnancy outcomes. And the last study I want to tell you about, I think I just have 2 or 3 slides on this, is called Nurtured in Nature. So most of my work has really been about changing places, but this is really my first study where I'm trying to intervene on people and changing how people interact with the neighborhood environment. So if we know nature is good for health, how do we actually get people to spend more time in nature to reap those benefits? And in particular, because of the links between mental health and nature, what I wanted to do was develop an intervention that would target postpartum women to see if we could to see if we could get them to spend more time outside with the goal of preventing postpartum depression. This is my research team. This is obviously me. Next to me is Max, the medical student I told you about. Next to him is Kenny, who is my amazing research coordinator. And next to her was Lee, who was our nature coach for this study. So this Nurture to Nature was a 4-week intervention that leveraged some behavioral economics insights, a nature coach, Lee, and digital health. So Lee did a home visit with each of the women in the study who were in the intervention that consisted of education, some goal setting. They actually had a map of the neighborhood and looked at different potential nature locations that the woman could go to. They brainstormed barriers and facilitators to reaching the goals, and then each woman signed a pre-commitment contract, really to herself, saying that she would spend time outside. Lee also did a park visit with the women. And then there was a digital health component. So there was a weekly digital nudge that they got via text message to get outside. And then one of the really cool things about this is that we use GPS data from the participants' phones to be able to calculate each week how much time they actually spent in green space. And then we sent that back to them in a progression badge to show if they reached their goal or not. The primary outcome here was time in nature using GPS tracking. So this is another strength of this study, that we did not rely on self-report on how much time people spent outside. We used GPS data. And secondarily, we looked at postpartum depression scores, but we were not powered to see a difference there. And then this is an example of what the text message would look like, text message reminder on the top. And then this was the progression badge. So if the goal for that week was 2 nature visits and they made 2 nature visits, then they would get something like this that says you did it. And so what we found, so we looked at intention to treat and then as treated, because we had 17 women in the intervention arm. 13 actually did the intervention and 4 did not. So this intention to treat includes the women who didn't actually get the intervention. And so in the control group, they had a median number of visits over the course of the study of 0. The intervention group had a median number of 3 visits to park space. And so there was a high incidence rate ratio of 2.6 intervention compared to control. This is the number of minutes in green space. And while not significant, you can see a strong trend in an increased number of visits and minutes. When we look at the as treated group, so there was a very strong signal here of increased number of visits to green space. And then again, increased number of minutes. So there, of the women who went through the intervention, they spent a median number of minutes in green space of 102 minutes compared to a median of 0 in the group that didn't get it. So again, this was exciting. It's, to the best of my knowledge, really the first study in adults to show the impact of an intervention to actually increase the amount of time people spend outside. Okay, so that's it. This is my last slide. These are just 2 of my favorite parks to go to near my house. They're both probably within 10-minute walk. And these places have been incredibly important to me during the pandemic, especially in maintaining my own mental health and dealing with my own stress in the pandemic. So I just wanted to show these spaces, and that's all I got. So I will stop sharing my screen and we can do questions.
Thank you, Gina. That was a fascinating talk. Really enjoyed it. So before I get to other people's questions, I'm going to be selfish and ask one of my own. It seems that adding green space to cities and cleaning up these vacant lots, in addition to reducing crime, would have direct, sort of economic benefits to the city itself. Has there been any work trying to compare the cost of how much it costs to clean these places up as sort of a way to sell it to policymakers?
Yeah, so actually we did a study, a cost benefit evaluation specifically for gun violence. And we did it for both this greening intervention and an abandoned house remediation intervention that I didn't talk about. But we demonstrated that there is a significant cost savings to both society at large and to taxpayers when you do these interventions with regard to money saved by preventing gun violence. And I should say that these interventions are relatively inexpensive. It costs about $1.78 per square foot to green a vacant lot and maintain it. And I should also say there's an important maintenance piece. So after the lot is installed, every 2 weeks they go back to do maintenance. So like mowing the lawn, picking up any trash. So that maintenance piece is important. But yeah, the cost argument is very important. And we have made some of that argument. one of the other things I'm actually doing now is looking at looking to see if there is an impact on emergency department utilization for care for stress responsive diseases. Because since we think that there's an impact on these spaces on stress, if you green vacant lots, will people come to the emergency department less? And that again is trying to build an economic argument to get health systems to invest in things like green space in their communities.
So moving on to the Q&A, there's a question from Donna Rizzo. She asks, you showed both a map of vacant land in Philadelphia and mentioned that people felt these vacant spaces were unsafe. When looking at maps such as 1, vacant land, 2, who lives where, and 3, land greening / interventions, are there spatial correlations between these maps that would allow you to optimize the selection of sites to provide the most positive impact on, say, health, mental or otherwise, or alter people's viewpoint on land being safe?
Yeah, so I think that this is a really important question of where to locate these interventions, and you can even expand that to, you know, where should cities plant trees? Many times, you know, green space is prioritized in gentrifying areas or areas that are heavily trafficked by tourists, for example. But you know, I would make the argument, and I think many people would make the argument, that you really should target these areas to the neighborhoods that need them most and who would benefit from them the most. So one of the things that came out of our work is that last year the city of Philadelphia included greening as part of their violence prevention plan. And the way that it was going to be determined, you know, where do you put these green lots, is in the areas that have the highest rates of gun violence. And so, you know, gun violence is very concentrated in the city. And so the idea was to look at data like gun violence. And I would say that you could also overlay, you know, health data, for example, to figure out where is the highest need, and then to target those areas for the intervention. So I hope that answered the question.
It seemed like it did to me, so yeah, thank you. So a question from, looks like Liza Morse. How did the PA Horticulture Society engage with communities prior to these green up projects? Were neighborhoods welcoming of these efforts, or was there a feeling that this was a top-down approach?
Yeah, so the Horticulture Society has been doing this intervention now for probably almost 20 years. It is a very popular intervention. So they get a ton of requests from community groups, and just from people to come and to green their vacant lots. Now, I will say, we actually, in one of the studies we did, there was an ethnography of different neighborhoods where this study was taking place. And in areas that were gentrifying, that were in the process of gentrifying, there was definitely more ambivalence about this type of intervention, because it was perceived as being a contributor to gentrification as opposed to something that was helping. In neighborhoods that were not close to gentrifying, this was a very welcome intervention. So the Horticulture Society, you know, they, outside of our study, they do this intervention that is paid for by the city every, you know, many lots every year. And they work very closely with communities and neighborhoods to, you know, decide where it's going to go and to make sure that it's a welcome intervention.
Excellent, thank you. So the next question is from Robert Herndine. Vacant lot parks must, he guesses, be highly manicured, but what about weedy parks? Is there evidence on the difference in beneficial impact of neat versus wilder?
So I don't know the exact answer to that question. I'm not sure if that type of study has been done. For this particular model, it really is about keeping these spaces neat and well maintained. Now, recently, actually, I know that PHS has worked with I think the National Wildlife Federation to put pollinator gardens into some of these lots as like a pilot. And those now I am not a horticulturalist, but those pollinator gardens are, I think, a little bit more like wild and natural. And so they're sort of testing out some different things to see what will work, and looking at the sort of benefits to biodiversity. But as far as I know, I don't know that there's been any studies on the impact of that with regard to health, human health.
Gotcha. So Christopher Kaliba says, an excellent presentation across the board, one of the best in recent memory. And then asks, do you surmise a link between people's propensity for time in nature and willingness to wear masks, socially distance, or take a vaccine?
Oh, wow. Yeah,
it's a tough one.
Yeah, I don't know. But so I have no idea. But I will say, it's been interesting during the pandemic, because spending time outside has clearly emerged as being safer than being inside. Safer in terms of, virus transmission. And then also there are like so many benefits, mental health benefits, to help deal with the stress that we are all feeling because of the pandemic. So I think, the inequities in where green spaces are and where well-maintained parks are, to me, has just been highlighted even more during this time when people are trying to get outside and take advantage of being outside.
It does seem like it's a whole lot easier to socially distance on a park than on a sidewalk.
Yeah.
Where you're kind of constrained to where you can walk.
Yeah,
absolutely. The next question is from Joe Holler. In the long term, is there a risk of gentrification pushing beneficiary populations away from the regreened treatment neighborhoods? Can you recommend any interventions to achieve benefits of regreening/green infrastructure while mitigating the effects of gentrification?
Yeah, gentrification is a topic that is always on my mind. And I don't know that any city has really figured out how to both have sort of healthy development and avoid gentrification. But I think we have to be mindful in how we do that. Having, mixed income housing is one way to do that. Making sure we involve community members at the table and making decisions, not just about green infrastructure and nature, but about development generally, I think is really important. And helping to make sure that people who already own homes in gentrifying areas can stay there. One of the things, even if you own a home as an area gentrifies, the taxes go up. All of the services and amenities that end up coming are more expensive than the ones that were there before. So sometimes people get priced out because they can't afford it. Then you also will have developers who are trying to, buy houses from people at what is probably a lot of money to them, but is below what market rate and what should be. So people are also pushed out in that way. So I don't know. I don't have the answer for gentrification, but what I don't want is for us to say, well, if greening is going to lead to gentrification, we shouldn't green spaces, because everyone deserves to have these spaces. I think one of the safest things is starting in, again, the hardest hit neighborhoods that are so far below the poverty line. There is no gentrification coming to those neighborhoods, and really focused on those neighborhoods is one way, at least initially, to try to prevent the gentrification.
It does seem like those areas get the greatest benefit from having those green spaces as well.
Yeah.
So just a comment from Donna. She said, thank you for answering the question and that she loved the talk. And then a question from Christine Vague. Beyond postpartum women, have you worked with other patient populations, or which populations do you see as possibly benefiting the most from similar interventions?
I haven't yet, but my goal with this intervention is, we pilot tested it in this population, and I hope as a next step to be able to do a, properly powered trial with more women to look for the impact on actual postpartum depression. But my goal is really to adapt this to other populations, because I think people who are at risk for or have cardiovascular disease like hypertension would be a great population for this. There's a lot of data showing the immediate physiologic benefits of spending time in nature with reduced blood pressure and reduced stress. So my hypothesis would be that for people who have high blood pressure, even if they're on medication or have trouble controlling their blood pressure with medication, that spending regular time in nature would help their blood pressure control. People with depression, not postpartum depression, but just everyday depression, I think that population would benefit. There's just not a lot of literature around this in adults. Now, I will say in kids, there is this whole like Park RX movement that's really in the pediatric population with physicians prescribing nature to kids and their families. But even with that, the evidence is very thin because we don't, there's one randomized controlled trial out of UCSF by Nushin Razani called the SHINE trial, where they had, families going into nature and not, and there were some supports around that. And they found impact on stress, but not an impact on the amount of time people spend outside across the groups. But outside of that, there have not been any really rigorously studied interventions to see how we can get people to spend time and what's outside and what's the health benefit. So I think that there's a lot of room here for future study. And I think that in 10 or 15 or 20 years, the way that exercise is a standard, health promoting tool that physicians talk to patients about, and that it's well known, like exercise, it's good for you and everyone should exercise, and there's guidelines for how many minutes. I think in 10, 20 years, we'll be there with nature. We're not there yet, but as the evidence builds, I think that will become more of a standard part of how we think about health.
So to follow up on that question a little bit, you had said something about the study showing an effect on stress, but not on time spent outside. So you're drawing a distinction between time spent outside and time spent outside in a green space of some sort, and that seems to have different effects for people.
No, so for that study, and I wasn't involved in that study, but
sure.
They had two different groups, one that got an intervention, one that didn't. Between those two groups, they did not see any difference in the amount of time people spent outside in nature.
Oh, I see.
When they looked at all people in the study, those who spent more time in nature had reported less stress. But it wasn't, the spending time in nature was not the result of the intervention.
I see. Okay, I see. I got you now. Sorry, I didn't quite pick up on that.
No, that's okay.
So I guess at this
Bailey, I have one question for you.
Oh, yeah, go right ahead.
So I know in Philadelphia, there's large urban parks that are often situated in poorer neighborhoods. And I was wondering if your studies looked at the greening of vacant lots in those neighborhoods that are already in close proximity to a large urban park, Fairmount Park, for example, and if the intervention in those neighborhoods where people had access to a large green space, if the results were less dramatic in those areas.
Yeah, that's a great question. We did not analyze the results that way to look at like proximity to other parks, if that impacted the results. But all of those neighborhoods did get the intervention. I will say, even like when you look at Fairmount Park, even though, and you'll know this because you spent time in Philly, so Fairmount Park abuts many neighborhoods, and it does abut like Strawberry Mansion and some of the other lower income Black neighborhoods. But it's not as simple as like walking across the street to get into the park, because there's only access points at certain areas. And so even like accessing a park like that is, maybe not as easy as it seems. And the other thing I will say is, when you look at something like the Wissahickon, which is, part of Fairmount Park and part of that park system, there is, I've just heard anecdotally, this is not a study, but anecdotally, that a lot of Black Philadelphians don't feel welcome going to parks like that. And so there's this whole issue of social access, which has to do with, the maintenance of a park, but also experiences or the anticipation of the experience of racism or discrimination and going to a park, and like whose park is it and who belongs here. So I think that's also something that needs to be considered and should be part of our like broader conversation that we're having as a country right now about racism. I think the example of Christian Cooper, who was a birder in Central Park, who had a white woman. So Christian Cooper was a black man. A white woman called the police on him and actually lied to the police and told the police he was assaulting her when he wasn't. We have the video evidence that he was not assaulting her. That type of thing happens to Black people, and the threat of that is sort of ever present. And so that speaks to like who's welcome in a space, what are the consequences of going in a space if you are not welcome. So we definitely need to think about that also as we're thinking about nature access.
Thank you.
Yeah, thanks. So a question from Joe Holler. Do you see opportunities for your research to justify accountable care organization investments in regreening? Also, thanks for an excellent research presentation.
Thank you. Absolutely. I mean, I really want to see health systems invest in greening, and health systems are investing billions of dollars in social determinant interventions, which are typically interventions that are meeting social needs. So, meeting needs around housing and food. There has not really been a lot of investment of health systems, or really any that I can think of, around green space. But I think that the health benefits would be tremendous. And so health systems should do this. Part of what I'm trying to do is build the case for that. And there has to be an economic case because, money is the driver of most decisions of what happens, in life for big organizations and companies. And so if we can show an economic benefit to health systems that they will potentially save money, for example, by reducing ED visits for uninsured patients, then I think we can sort of start to build that argument, and more health systems would do that.
Gotcha. Thank you very much, Gina. It was a fascinating talk, and really appreciate the time that you spent here with us. And yeah, hope you have a great day. I guess we're at the end of the
Excellent.
talk.
Thank you so much for having me. It was a pleasure.
Thank you.
So long.
Let's see. On behalf of the Gund Institute, I want to thank Gina and everyone who joined us online. We'll have the video and a podcast of today's talk available next week. Please join us again next Friday for our next Gund Exchange with Tim Toyer from UVM, whose talk, Ecological Kintsugi, a paradigm for habitat restoration, will be on October 30th. Thank you, and see you then.